So we're going to keep the medical rolling. We are getting close to the end. Now we're looking at non-skeleton musculoskeletal disorders. We're starting with non-traumatic fractures. Let's take a look at some pathological fractures and some reasons why something like that might happen. And the first one, we start with osteoporosis. The most common cause where bones become brittle and fragile due to loss of bone mass. And this bone degeneration just happens over time. Believe it or not, more commonly in Caucasian women, osteoporosis just is a bone mass just keeps dropping and dropping and dropping. And then all of a sudden you're running a call on Mrs. Smith who fell and she broke her hip. Next, we're looking at bone tumors. Both benign and malignant tumors can weaken bone structures. Next, infections, conditions like osteomyelitis that can erode bone tissue. So osteomyelitis is a bone infection. Bone infections can be bad. They can spread. Metabolic bone disease, disease such as osteomalacia or Pagets disease, affect bone formation and strength. Genetic disorders, conditions like osteogenesis imperfecta, can result in fragile bones. So someone could be born with osteogenesis imperfecta. An endocrine disorder, such as hyperparathyroidism and other hormonal imbalances that will affect the bone's density. Remember, your endocrine system does more than just push hormones around. It allows your body to maintain homeostasis, and your bones is part of that system. For signs and symptoms, patients might present with pain, swelling, and decreased function of the affected area without history of significant trauma. For treatment similar to traumatic fractures, immobilize the affected area. Oxygen, IV fluids is needed, and they may need to be treated for an infection. So just because your patient states that they didn't fall, or might state, hey, I woke up and my arm is hurting, we need to take this serious. We need to do a good evaluation. Make sure we're assessing for pulses, motor, and sensation or sensory, just so we don't miss any of these pathological fractures. Next, let's take a look at spine disorders. It says degenerative spine disorders, starting off with osteoarthritis, a degeneration of cartilage in the joints of the spine, leading to pain, stiffness, and a decrease in mobility. Next, degenerative disc disease, a breakdown of the intervertebral discs causing pain, weakness, and or numbness. Last one there is spinal stenosis. Whenever you see that word stenosis, it's in a lot of different things. It means a narrowing, okay? Narrowing of the spinal canal that can compress the spinal cord and nerves, leading to pain, numbness, or weakness. Next, let's take a look at the herniated disc. This is when the inner gel-like core of the spinal disc bulges out through a tear of the outer layer, potentially pressing on the spinal nerve and causing pain, numbness, and or weakness. Oftentimes, this herniated disc is due from a compression injury, or it could be from somebody who's lifting incorrectly. People get herniated discs from horseback riding, from car accidents. There's a lot of different ways that disc herniation can occur. Some spinal deformities, please know these. Starting off with scoliosis, abnormal lateral curvature of the spine. It literally looks like an S for scoliosis. Next one is kyphosis, excessive outward curvature of the spine, leading to a hunchback appearance. Often this is seen in our elderly community. That is kyphosis, and this is why we have such a difficult time putting these people on a backboard. Next is lordosis, excessive inward curvature of the lower spine. And you can see some of these photos here at the bottom of the page just to help you out. Next, let's take a look at neoplastic disorders. These are tumors. Whenever you see that word neoplastic, think tumor. Abnormal growths in or around the spine, which can be benign or malignant, which means it could be non-cancerous or cancerous. Some other conditions that are worth noting. First is sciatica, pain radiating along the sciatic nerve pathway. Remember, that's through the leg, often due to a herniated disc or spinal stenosis. And here's a crazy word, spondylolisthesis. That word. One vertebra slips over the one below it, often causing pain and nerve compression. Crazy medical term right there. Next, we're jumping into joint disorders, starting with arthritis. Osteoarthritis is a degenerative joint disease characterized by breakdown of cartilage, leading to pain, stiffness, and reduced joint mobility. That's what osteoarthritis is. Rheumatoid arthritis is an autoimmune disorder. I would definitely highlight that. That's big with rheumatoid arthritis. It's an autoimmune disorder causing chronic inflammation of the joints, leading to pain, swelling, and potential joint deformity, which I'm sure you have seen that in the past with some elderly patients. Their toes look like they're doing gang signs. Next, we're looking at septic arthritis, an infection within a joint, often caused by bacteria, leading to severe pain, swelling, and a fever. Next, these are called crystal-induced arthropathies, starting with gout. Gout is caused by an accumulation of uric acid, highlight that, uric acid crystals in the joints, leading to sudden, severe pain, redness, and swelling. Here we got an autoimmune and inflammatory disorder, starting with systemic lupus erythematosus, SLE, an autoimmune disease that can cause joint inflammation and pain along with other systemic symptoms. So we got a couple autoimmune diseases here. And with soft tissue disorders, starting with tendonitis, inflammation of the tendons, who would have thought, that are around a joint causing pain and limited movement. And bursitis, inflammation of the bursae, which is a small fluid sac that cushions the joint, leading to pain and swelling. Starting off with myasthenia gravis, this is a rare condition, but I have ran calls on this condition. It's an autoimmune disorder, again, characterized by a production of antibodies against acetylcholine receptors at the neuromuscular junction. So this impairs the transmission of nerve impulses to muscles, leading to muscle weakness and fatigue. The thymus gland is often abnormal in these patients, sometimes showing hyperplasia or thymomas. So acetylcholine is a neurotransmitter that's often talked about with the parasympathetic nervous system, but in this case, this patient's having a difficult time with movement, right? Weakness. Let's take a look at these signs and symptoms. The hallmark symptom is fluctuating muscle weakness and fatigue, which typically worsens with activity and improves with rest. Commonly affected muscles includes those controlling the eyes and eyelids, leading to ptosis and diplopia. Facial expressions, chewing, swallowing, and speaking. Limb and respiratory muscles can also be involved, leading to more generalized weakness and myasthenic crisis, a severe exacerbation that involves respiratory failure. Can't say I've ever seen that, but like I mentioned, I've ran some calls on patients with myasthenia gravis, and they usually walk with like a cane or a walker. For us, just supportive care. If that's all we're treating, obviously, if the patient's going to respiratory failure, we're going to have to assist with ventilations in that case. Now, here's something that you may have experienced yourself. These are overuse syndromes, also known as repetitive strain injuries. These are conditions caused by repetitive motion, overuse, or sustained exertion of muscles, tendons, and other soft tissues without direct trauma. A very popular one that I see, especially in the fire service, is tennis elbow. Inflammation or degeneration of the tendons on the outer side of the elbow, commonly due to repetitive wrist and arm motions. Often people do experience this with even working out in the gym. Next, we got golfer's elbow. Inflammation and degeneration of the tendons of the inner side of the elbow, often caused by, again, repetitive wrist and forearm motions. Now we got Achilles Tendonitis, inflammation of the Achilles tendon, usually due to repetitive stress or overuse, often seen in runners. I don't have to worry about that one. Other common overuse syndromes. Carpal tunnel syndrome, compression of the median nerve as it travels through the carpal tunnel of the wrist, leading to numbness, tingling, and weakness in the hand and fingers, often caused by repetitive wrist motions. I know that's a popular one with people that work too much on a desk or on a computer. Plantar fasciitis. I have seen test questions on this one. Inflammation of the plantar fascia, thick band of tissue at the bottom of the foot, causing heel pain, often due to repetitive strain from activities like running or prolonged standing. Medial tibial stress syndrome, or Shin splints for short. Pain along the inner edge of the shin bone, often caused by repetitive impact activities, again, like running, typically from poor footwear. Trigger finger, inflammation of the tendons of the fingers, causing them to catch or lock when bent, often due to a repetitive gripping motion. The last one that we're going to talk about for this section is rhabdomyolysis. This is an emergency that you need to know. Rhabdo, for short, is a condition characterized by a breakdown of muscle tissues, resulting in the release of muscle fiber contents, including myoglobin, into the bloodstream. Now, myoglobin is a protein that is in your muscles, and it is supposed to stay in your muscles. It's not supposed to break down into the bloodstream. It can be hazardous. This can be caused by various factors such as trauma, prolonged immobilization, extreme physical activity, drug use, or certain medical conditions. The released myoglobin and other cellular components will cause kidney damage and acute kidney injury. Now, we know your kidneys are there to filter out your blood from any sort of toxins. Well, guess what? This myoglobin is a toxin that your kidneys are going to have a very difficult time with. And unfortunately, it will cause kidney failure. Let's take a look at some of these signs and symptoms. Muscle pain, weakness and swelling, often accompanied by dark colored urine due to myoglobinuria. So obviously that myoglobin is in the urine. Additional signs may include nausea, vomiting, confusion, and irregular heartbeat. In severe cases, there may be signs of acute kidney injury, such as a decreased urine output and fluid retention. Now, I will tell you that most people in the fire service specifically suffer from rhabdo due to excessive exercise, typically in fire school or going through some sort of academy. This can be really dangerous for that candidate or for that cadet. Let's take a look at the treatment that is mandatory. The goal is to prevent kidney damage by ensuring adequate hydration. So you probably already guessed it. The patient's going to require fluid administration. This is typically achieved through aggressive intravenous fluid administration to maintain urine output and dilute the myoglobin in the urine. In severe cases, dialysis may be required if kidney function is severely impaired. Other treatments may include correcting electrolyte imbalances and addressing the underlying cause of rhabdomyolysis, and monitoring and supporting organ function. Oftentimes, we do see rhabdomyolysis being treated with hyperkalemia, which is an increase in potassium levels.